Next, we'd like to welcome Dr. Lichtveld. Dr. Lichtveld is the Dean of Public Health and a professor in environmental and occupational health at the University of Pittsburgh. Dr. Lichtveld's national and global environmental health research examines the cumulative impact of chemical and non-chemical stressors on communities facing environmental health threats, disasters including pandemics, and health disparities. She also serves on the board of the Consortium of Universities for Global Health and earned recognition as the CDC's Environmental Health Scientist of the Year. Please welcome Dr. Lichtveld to the stage.
I'm delighted to be here. And when Joel asked me to do this, I thought, I'll take you to the front line. And I'll take you to the front line to see how disasters and climate change create that cumulative impact on the health of women, and particularly women in a vulnerable period. And so we know about what's going on in our body. We also know that cultural and religiously based gender roles can be harmful to women and girls. We also know that there are physical and sexual violence, and I'll take you to a community where that's occurring in the country where I come from. And then we know that as Dr. Coleman shared, happens across the life stages, not only in a certain life stage. And so whether it's from the perspective of exposures, and you've heard about that, or the sensitivity that in a particular life stage, or the ability to adapt as we get later in life. All of those things impact women's health. We know that the physiology of women is impacted by the specific metabolic needs we have in life stages that we go through. Certainly, I've gone through most all of those life stages right now, and I can attest there are specific metabolic needs. We know that extreme heat, as you've heard, also impacts and increases the risk for preeclampsia and preterm birth. So we know all that, but how can we impact all that? So why am I taking you to an infectious disease that you thought was only in a lower and middle income country? And some people think that we are smart enough to protect our country, the US, and will stop all the mosquitoes that are coming in. Well, as far as I know, mosquitoes don't know borders. And so this is a bit elementary if you haven't had this much of infectious disease as part of your training, and I'll come back to that. There are 4 types of dengue. I had 2 of those, dengue 2 and 4. And I'll tell you a little story of what happened to me. When I had dengue type 2, I was practicing in the Amazon rainforest as a young physician, and there was no problem in diagnosing me and treating me. I went back 30 years later with students and you'll see that too, to experience what I did when I was practicing as a young physician. And I came back with dengue type 4, because dengue is endemic. And I had a tough time explaining to my primary care physician, I didn't want to trust myself only, that that's what I had. Because my symptoms looked just like the flu. And that physician, and in general, or training in medical schools, didn't typically spend enough time on infectious disease. And so here's the life cycle of the Aedes aegypti mosquito. And the Aedes aegypti mosquito is very smart. The mosquito loves flooding, and we have flooding everywhere globally. But the mosquito is a daytime mosquito, so it doesn't wait till you go to bed and then it's active. The mosquito also loves muddy water. And if we have imperfect drainage, and many cities, I lived for 15 years in New Orleans, and so I know all about what imperfect drainage looks like, or in rural areas in our country, that's what the mosquito likes. And so while the data in some cases are limited, we know that dengue impacts the risk of maternal death. And we particularly know that dengue impacts maternal deaths from the complication of dengue hemorrhagic fever. We know that a pregnant woman can pass it, and we know that it has harmful effects. But this is why I wanted to talk to you about this real case of dengue. Look at the US. The mosquito knows how to cross the border into Florida, into Louisiana, into Texas, and it's coming upstream because of 1, heat, and 2, flooding. So it's important to us to know about the mosquito, to know about dengue, and to know about the impacts of pregnancy on dengue. Vertical transmission is what we're worried about in addition to the health of the woman, but the health of the child. We know that babies can present, just like I did with dengue type 4, as a fever or very mild symptoms. And it might go unrecognized if our pediatricians are not trained in those areas. Because here are the symptoms. You know, a little bit of fever, joint pain, headache, coughing. Doesn't that sound like the common cold? It's not. So case number 2. This is in Florida, Hurricane Michael, well-funded, thank you, by NIEHS. It's the work we did. And we looked at 4 areas. So relationship between environmental exposure and birth outcomes, relationship between general disaster-related issues and birth outcomes, and then looking at disaster-related exposures and the combined impact of environment and gender-related issues. And I led number 4. I led aim number 4 because I wanted to make sure that after we did this research, primary care physicians practicing in Florida knew how to recognize adverse pregnancy outcomes related to disasters. We don't have a lot of time to go into detail, but here are some of the conclusions, and goes back to the care and what our the opening speaker talked about. We had later prenatal care services for these women who lived in that area. The prenatal care services were ineffective and insufficient for clinics that couldn't operate because they didn't have electricity. And the late PNC only really partially explained the decrease in small for gestation and birth outcomes. So what else played a role? We saw that the complications were more prominent in vulnerable women, pregnant women. We saw that when pregnant women had later access to prenatal care, we had an increase in adverse birth outcomes. And so we couldn't really wait for FEMA to let us in. Rather, what we did is use predictive modeling using, and that's exactly what we did after Hurricane Katrina too in New Orleans. We used the blue tarps as our sentinel event to see where the lack was in prenatal services. And those blue tarps helps us to then look at where the vulnerability are and work with the local authorities to bring care to them. And so we don't have to wait to be let in. We are smarter, but we can model. So case number 3. We know that, and what a brilliant idea, Joel, to look at the world around us, because the world around us impacts the world within us and impacts the world we form. So the environment impacts both humans and animals and plant health. The environment then, the climate change is then on top of that, and you heard Dr. Coleman talk about it, that cumulative effect that exists. So it's not 1 + 1 + 1 is 3. It's 1 + 1 + 1 is 1,000. So I'll take you to Suriname. That's where I was born, in the Caribbean. It's the country with the largest percentage still, it's changing, but still, of Amazon rainforest, and to a rat infestation rat infestation started because there was increased flooding and not enough drainage. This area of the country, 60% of it is built on agriculture, and our second speaker talked about that. And that's where their source of income is. And so everyone, the whole family, is part of that agricultural area, not only men. It's men, women, children. The whole family are in the rice fields. And so there was a rat infestation because the rice fields weren't well kept, because of people couldn't deal with the flooding. Breakage of dams happened, and I'll come back to that, and very heavy rainfall. And so in the past, when I grew up there were 4 seasons: little rainy season, big rainy season, real dry season, long dry season. No more, it's all rainy season. So this decreased crop yield, this is aubergine and cucumber, if you recognize that, created food insecurity, but also economic loss, impacting women directly. We also, and this is a bit of environmental toxicology here, the application of this rodenticide was, the safe application was at 0.0025%. But what the farmers did, it came in illegally because the help from the city took a long time to get there to the far western part of the country. They used it at 0.5% with the result of animal deaths and death in a very favorite fish. And so the country started a surveillance effort, but here is what should concern us. Not enough funds, and we talked about the economic impact, to have access to the very fancy laboratory techniques that we have. And so the country couldn't do all the PCRs that it should be doing. And so if it quacked like a duck, it was a duck. And we treated it as a duck. So the risk factors primarily here were the agricultural area of the rice fields that were not well kept, but because of the increased flooding. And here you see the life cycle of the rat, because many of the people are too poor to use personal protective equipment. And so what did I do? I went back to the country, to that area, and I didn't go and played the epidemiologist that I am. I went back and trained 38 midwives, doulas, to take action locally in areas that they can. Symptom recognition, so that it's not treated as some other disease, and particularly preventive methods. And so while they learn on the front line of rat infestation every year, I take students from our school and actually from the entire University of Pittsburgh with me to learn on that front line every summer. As you could see on the left, coastal erosion because of because of climate change there. A very special turtle that only lays eggs at night, and for the first time, last year, when we went, my student and I saw this turtle at 11:30 in the morning. The clear impact of what's happening because of climate change. You see one of our students planting mangrove seedlings to help against the coastal erosion. The dolphin on the left is very rare. It's only on the coast of Suriname and Brazil. And the habitat of the dolphins is what the students help as part of their 120 hours of service learning and in the Bachelor's of Science and Public Health program. They help restore that habitat. And yes, sloths, because of deforestation, are rescued out of the Amazon rainforest and actually in a sanctuary, and they do take the bottle. So if you want to join us every summer, please do. Thank you.